Is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is March 22nd. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the facility-based day habilitation reopening discussion. Our presenters for today include Kennedy-Lizotte from the National Association of State Directors of Developmental Disability Services. We also have, excuse me, Kathleen Walker, Employment and Family Coordinator for DDA Eastern Shore Regional Office, and Patricia Sustoke, Director of Programs. Before I begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode to start, and there are two options to hear the webinar, by computer and by phone. And if you look at the panel interface on your right, labeled Audio, you can click either computer or phone to switch for the best option. There is a handout for the webinar, and you can find it in the handout section in the panel to your right, and they can also be emailed upon request. We will be recording the webinar and posting it on a YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those throughout the presentation. So now I'd like to introduce Patricia Sustoke. Hi.
Good morning, Donna. Thank you for the introduction, and thank you, everyone. We really wanted this webinar to be more of a conversation. There's over 180-something people there. So we're hoping to guide this discussion in a way that you feel comfortable, the way that you feel that you're getting some input, and then we'll make sure that we get the questions to Ree or to us to provide you with some final DTA guidance or feedback. I also wanted to tell you that we know that everyone is at a different stage. We know that some of you have learned a lot in the last year. We also know there's some of you who are struggling due to not having direct support professionals, or trying to figure out how you're going to reopen, or what kind of soft reopening you're doing. And so we don't expect answers, and we know that people are working on it together. Next slide, Donna. So one of the things that we wanted to talk to you about was is kind of go over a little bit of the agenda. And it was really an introduction of what is it that we're trying to do. We have over 206 participants right now attending our webinar. Kennedy-Lizotte from NASDDDS is an expert in employment services, been talking to other providers who provide meaningful day services, day habilitation across the country, who can share with all of us what people are doing, what things to watch out for, what some innovative things that are happening. But again, you know, we're always very unique. Every state is unique. Every state has their own policy requirements, idiosyncrasies. And so we want to make sure that just because something works in the state doesn't mean it's going to work in Maryland. So we know that, and we want you to know that. And we're going to talk about our objective for today, and then the NASDDDS is going to go over an overview of presentation. And then we're going to share a little bit about what kind of funding resources are available that you can tap to. So next slide just has some really good information about how to get in touch with Ree in case you have any additional questions afterwards. NASDDDS has partnered up with us for the past, 7 years or longer, and really are working with us in multiple levels. And so we find NASDDDS as a really partner in helping us. How does DDA really keep up with best practices of what's happening across the country when it comes to transformation, when it comes to reopening day programs. And I don't know if you've seen some of the resources that NASDDDS has put out, but they actually do have a resource guide on how to think about reopening under our state of emergency. So the next slide really just has our basic objective. And our objective really is to have a dialogue about talking about how to reopen. You know, as you know, DDA never has put together, this is how you're going to do it, because we know that at an individual level, is at a regional level, is at a provider level, is at your board level, and you all work with boards, you work with families, and you work with participants. And so we really wanted an opportunity to really think about together, what does this look like for Maryland? We don't have a magic, crystal ball that tells us this is how it needs to work, or this is what it's going to be like, and this is going to be successful because so-and-so did it. It doesn't work that way. So we really want to know that this is for all of us a very learning experience. For all of us, it's something that we are trying to learn together. from each other, with each other. And so I am now going to, hopefully, the way that we talk about this and the resources, it provides flexibility, it provides an opportunity for us to dialogue and communicate. So what we're doing, because Ree does have a presentation, we also want to take some time in between to take some of your questions and provide some answers and some dialogue. And so if we need to open up a mic, we'll do that. But if you can type in the chat box or the question box, we'll be tracking those. So Ree, I'm gonna turn it over to you. Next slide, Donna.
Thank you so much, Patricia. And it's such a pleasure to be with all of you today. I'm going to start this with a bit of overview of how all states are thinking about the time period we're in right now and how to begin to come back to some semblance of regular service delivery. That doesn't mean that we're talking about coming back to services as they once existed, because we're at a different point in time. So how do we really seize the opportunity right now to bring some continued innovation into our systems as we support individuals to have meaningful lives? Next slide. So this is about all of you. You are providers who have provided services, day services through your facility-based structures. We do know that in Maryland, that means that you still have people get out and about in the community. You just happen to have this category of facility-based provider system. So next slide. So what are the efforts that are going on across the country? As you could well imagine, as we think about the system as a whole, there's three major components that we think about in terms of what needs to happen at the state level, so the systems level, and I would include some of the federal level in that, because that is an ever-changing landscape that we're in right now as well. Certainly at your level as providers, what do you do? What are the things that you're paying attention to and need to put in play as you think about coming back to supporting all the people that you supported prior to the pandemic a year ago today? And then what do we know families and individuals are thinking about in terms of what lessons and supports that have occurred for them during the pandemic and what they would like to see from all of us, both at the provider and the state level, moving forward for supports for people with intellectual and developmental disabilities. Next slide. So these are some of the challenges that states are really working through, and some of the things that they're hoping to achieve or are considering as solutions for dealing with the issues. We certainly have the ongoing compliance to the home and community-based settings rule. So the regulatory compliance. What has happened during the pandemic is we've released some of the constraints of that compliance, but we still have a responsibility to think through how to come back to full compliance. CMS is loud and clear on that. They are adjusting to some options going forward, but nonetheless, those still exist, and they're front and center in the minds of states as we reopen services. Certainly, we have all learned to use technology way beyond what we thought was possible over the last 12 months, and it continues to evolve. Just the availability of programs and apps and platforms that have come into just general practice over this last year is extraordinary. And states know through the pandemic that there's even a higher expectation of gathering information and building on not just what services are delivered, but what are the outcomes of those services as we try new models of service delivery. I don't know if this is on your radar, but it's certainly on state's radar. The electronic verification implementation. States are front and center in this and have the potential of losing money in their systems if they don't have all their provider systems up and running and their states functioning to verify electronically what services, certain services are delivered. So that is certainly front and center. The direct support workforce shortage, as you guys know even more acutely than the state systems, it looms large. We are very fortunate, I think, that our new administration considers this a priority. And as we look at the administration's positions on issues, and even the fact that they have a disability-specific presence in the White House now with the new disability leadership in the White House, their top priority is the direct support workforce. So we expect, and we see even now with the new bill that came out, to the new relief bill, has a great attention for the HCBS services and resources and attention to the direct support workforce. How that will roll out is still to be seen, but there's resources to put towards this challenge we all have. States are acutely aware of the intense need to support folks with co-occurring disorders. Through the pandemic, this has even to heightened awareness for state-level systems. And then front and center is always the reality that we have more individuals asking the state systems to make available opportunities and services that support them to enter into employment. This is a poverty issue for our systems, and I won't go into that today, but really that's another priority in our state system. So I want to just share that with you. Next slide. This is what we've heard from providers and the ongoing challenges, and you'll see that it reflects very much some of the concerns the state systems are facing. We know your financial stability is super important. It's super important to us as state level systems workers. We know that we can't do our jobs unless you exist in a very strong way. And we have had a renewed focus on the importance of helping shore up your financial structures and shoring up your business models. We continue to know as a system, and I will go through this in a minute, but there's a acute refocus on individual service delivery rather than dependency on program design service models. And hopefully, through some of the conversation we have today and your questions, we can get into that more. Again, the direct support workforce and the challenge of recruiting new staff and the challenge of managing recruiting staff that we need for individualized services rather than congregate model service delivery. Use of technology as part of the solution, as we see from the information we've collected this year, and the use of technology, and that's how that's supporting individuals on an individual level. So hopefully we can talk more about that. Again, the increased interest in having providers deliver good quality employment services so that individuals can get into the competitive workforce, just the everyday workforce as we expand the economy in our country. Meaningful life supports that happen outside of when people are working. Oftentimes it's been thought of, if individuals go into employment, then they're going to miss out. They're going to go into sitting on the couch and not doing other things. Well, in reality, what we're seeing is individuals are moving into employment, and that's one of the growing areas of our system, certainly not growing as fast as non-work services, but we are seeing individuals using non-work services to balance times in their life to support them to do things that all the rest of us are doing in our everyday lives.
Unmuted.
There we go. I think I'm unmuted again. So sorry. I don't know what happened with technology. I tried not to touch buttons. Hopefully you heard most of what I was saying, and the recognition that we clearly know the challenges you are faced as providers of day and employment services. So move on to the next slide. So what have we learned from families during the pandemic, and what do they have to say to us about what they're interested in moving forward with reopening of services? Next slide. Well, many families have found the pandemic stressful, to say the very least, and the disruption in their lives. Some good things have happened in supporting them through the pandemic and how they'd like to see services delivered going forward. They've shared with us through some national surveys that peer-to-peer support is critically important. And they are asking, as states and providers open up, that we help support them to have connections with other families, and for individuals themselves to have connections with their peers. So peer-to-peer support and how they think through issues is super important. We know for quite some time that those of us in the system, whether we're state staff, case managers, providers, families are always a little bit weary when we say, but we promise we can do this. We have designed services to help get you what you want. And these are the best ways to use our services. When we know that families don't depend on us for that knowledge or the truth of the getting beyond the myth of what is perceived or real in our systems, they depend on each other. What have you tried? Who do you trust? What other providers have you talked to? All those things through the family network. So as we move forward in reopening, families are very interested in us supporting that peer-to-peer and individual peer-to-peer supports in our system. They absolutely are sharing with us that they have benefited from more individualized services through the pandemic and want to continue that. And we'll talk more about what that means. That does not mean one-on-one paid services. It means focus on what each individual needs from the system, and not necessarily a 5 hours a day, 5 days a week program structure. That's our program model. Individualized services means on-demand services and some structured hours of service during different days of the week, different hours of the day, even on weekends. So that turns our facility-based program structure upside down, and I truly appreciate, because I've been in your shoes as a provider of those types of services in the past, and know what it takes to limit the amount of facility-based only services you provide. So hang on to that. We'll talk more about that. And what we've also learned during the pandemic is that people have continued to learn new skills through, just like all the rest of us. I can't tell you how many new platforms of virtual exchanges like we're on today. This is GoToMeeting or GoToWebinar, excuse me. See, there's GoToMeeting, there's GoToWebinar, there's Zoom. There's all kinds of different platforms of technology that we're using. There are apps to remind us of different things that we have during our days and weeks that we're all using. We've learned to shop online in ways we never did before. And all those kinds of things are happening for individuals with disabilities as well. They are learning to use these electronic technology platforms in ways we didn't think possible. NASDDDS had on a webinar just last week an individual who works for a county system in the state of Washington, and he worked in the county office. He was an individual with an intellectual disability with some challenges that we didn't share during the webinar, where he does data entry for the county system, including some financial data entry that affects payments to providers. Then through the pandemic, and when they all went to remote workforce, he too learned how to do his job remotely. And even though he misses his peers on the job and looking forward to going back to the office, he has learned new skills doing his job remotely. So one of the things going forward, because we're hearing from the industries at large as we open economies, industry beyond our disability industry is having major conversations about how many of us will continue as remote workers as part of the efficiency in the industry and reopening of businesses. So you probably as providers are thinking about that too. Which of your staff will work remotely and which won't? How much office space do you need or don't need as you reopen your programs? So next slide. I'm going to try to talk faster here. I know we only have an hour. I mentioned peer-to-peer. Families are calling for this. Individuals are calling for this support from the system. And hopefully as providers, you'll embrace this as well. Next slide. More individualized services. I've shared some of this before, and we want to continue to explore this. Individuals are saying as things open up, they really do want the option of having continued services delivered remotely or virtually, as well as opportunities to come back to structured supports outside their homes. So bear that in mind. Think about as what's the phrase that's been using, hybrid models of service delivery. Next slide. Individuals have learned new skills, both on the job and in how to relate to their peers. We have all been used to, over the last year, using these virtual platforms to visit with friends and families, to have games online that we play with our friends, to participate in reading and storytelling from our local libraries, cooking classes that restaurants have offered to the community at large, and we should be thinking about those as expanded opportunities as we think about opening our services and complying with the home and community settings rule, rather than just creating disability-specific learning environments in this virtual world we're in, to tap into the ones that have been opened up in our communities that all the rest of us have participated in through the pandemic. We know that there's going to take different kinds of skill sets and prep work on our provider staff level, but think about that as an opportunity to move forward as you reopen your supports and your programs. Next slide. So let's take a minute. One of the things that will be a challenge for you as providers is to not only track services on attendance, but really what kind of supports and service delivery do you offer on an hourly basis in your programs, and then in the support services you provide. Having been in the seat of closing 2 day programs years ago, probably way before most of you have been thinking about that. I was part of closing 2 buildings that we had, where we had over 180 individuals that we supported through day program. And we moved towards a system where we shut down those buildings and offered all those individuals supports through employment and other meaningful life activities. And that included, believe it or not, supports within their home when they're not out and about in the community, in combination of support with their residential providers. That was a lot of consideration and thinking to go through and dealing with. But one of the things that became very clear to us is the need to have our infrastructure at the provider level able to document hourly activities or combinations of hours. So did we on Monday offer this individual 3 or 4 hours of support at the YMCA or in their volunteer job at the community nonprofit daycare center? Or did we support them in 4 hours of job where they worked from 5 in the evening or 4 in the evening till 8 in the evening or something like that? We had to very quickly have our infrastructure, our technology, and managing case notes and billing activities on an hourly basis. So I'm going to stop for a minute. Are there any thoughts or questions any of you are thinking about? But heads up, as you think about reopening, one of the important components that you'll need to think about is how to track your activities of support, both in terms of hours you provide and in what kind of service activity, and do you have case notes that can link to billing other than on a daily basis. Do we have any questions or comments on that in the chat?
Not specific to that questions, but there was one just recently about virtual supports, and it just had, you know, that they've heard that virtual supports may not be, may not meet the needs of a person if they live at home, and what would be limited to virtual support services delivery model. And what we're saying is the virtual supports were added to our recently approved waiver amendments, and virtual supports will continue under DDA's employment services, supported employment, CDS they have, and personal supports. And DDA has guidance memo on the amendment on our website. So we'll share that information. And that's the main one. And the other one, Ree, is that people asked, talked a little bit about, you know, the hard piece is the DSP and recruiting DSPs and bringing them in at a higher rate. And so they were just trying to figure out that that's a huge challenge on how to bring people in at higher rate and also to do the work. And so they wanted to know, hearing anything across the country about DSPs and rates.
So more to come. I'll tackle the DSP in a minute, but to the first point about virtual services, remember, one of the things we've learned through the pandemic is that, just as we've always said, we're talking about support based on individualized circumstances, the living environment they're in, their choices, what's available in their community. That's really what individualized services are about. And some individuals will benefit going forward with virtual service delivery, others will not. But we need to be very conscious of all those options. And as providers, really building our offerings of service support in all those different service delivery modalities or models or supports that we do. I always like to think we support people the way they need us to support. And if we think about them one person at a time, we'll get there. You can't think of everybody all at once, or you get super stuck and overwhelmed and can't imagine how we're really going to do this with, and and we're already doing it this way with everyone that we need to support. So give yourself some grace on that, but be open to helping think through with individuals and their families or their residential programs, what's the best model or best way you can support an individual in service delivery. And as far as the direct support workforce, I am optimistic. We certainly are seeing that we have resources coming down through the increase in HCBS supports for states for this workforce, but it's only, the increase will be only during the time period that we're still in the pandemic. And right now, the healthcare emergency goes till December of 2021. May end it early if the federal government declares that, but right now the money that's put there for direct support workforce goes with that time period. So we have to be very cautious that we don't build it into our ongoing operation costs, but we will be during this period of slowly reopening and phasing in the reopening of our services through potentially sign-on bonuses, hazard pay, increased training to teach staff new skills, different cost to recruit and the cost of recruiting differently. So those kind of resources would be available for those things. I can't promise or even say how we're going to support this workforce long term until we see what the federal government does on the economic relief fund. There's clear recognition at the federal level that our workforce, our industry has been ignored in the economic stimulus that's happened in the past. So we're going to be tapping into, hopefully, I am optimistic about this. My belief that we're really there because we have folks at the top level of the new administration recognizing that our industry has been ignored in terms of economic growth through the Department of Labor activities and our general workforce development system. So all I can say to you right now is stay tuned, be hopeful. There is more relief coming, but the immediate relief is going to be used for the short-term boosts to bring staff back to our systems. And as we think about delivery in this new world we're in, you may, as providers, want to be thinking about how you revise your job descriptions and how you recruit and what types of individuals do you want to recruit into the system. There are lots of folks that are unemployed right now that'll be stepping back into work. And I was really quite taken aback and encouraged at the same time. I was reading some new stats from the folks that track recruiting of workers and are interviewing workers and expected changes. The industries at large, so all kinds of businesses across this country, are expecting to lose or see shifts in the workers that they've been dependent on, whether they're currently working or they're on furloughed status, that we're expecting great shifts in what kinds of jobs people are going to look for going forward. And one of the advantages we have in our system is that our direct support workforce, we provide an opportunity for lots of different day-to-day activities that staff do. We know we challenge them to the hilt on responsibilities, but it also are jobs that create a lot of variety. And the newer generation is really looking for variety in their jobs and the potential to offer back as a social give back to their community. So think about that. Think about your job descriptions. Now's the time to be rewriting them. Now's the time to be thinking about what you would recruit for. Do you want staff to work in a facility, or do you want staff that, one of the things I learned when I was doing this conversion stuff is that I actually had to hire some staff that were athletic, that wanted to be out and about all the time. I needed staff that helped individuals connect to the community at large, which was way different than hire them to come into a facility and work through a curriculum during the day. They had to be incredibly flexible, and I needed different kinds of staff and had to recruit differently. So think about that. Next slide. I'm going to try to keep us moving because we have a still have an end time at 11 o'clock. So not everyone will come back to services at the same time. So as you think about strategies for reopening, you really need to think about phasing in and who's going to be ready when. Different individuals will be getting different vaccines in their households. So it's not only the individual and your staff, but who they live with will play a role in who's ready to come back and work as staff and who's ready to come back in terms of receiving services or expanding the services they're currently receiving from you. So that comfort in return to work plays out. For you as providers, you're going to have to be thinking about accommodations for the staff that are ready to come back. We expect to see a rise in staff challenging accommodations under the ADA, the Americans with Disabilities Act. As providers, you probably are already thinking about that. You may have staff that are eligible to claim accommodations as workers under the ADA that would never have come to the table before, simply because of the higher risks they have in coming back into mingling amongst the general populations at large. And we have to keep front and center in the needs of families. The level of risk is going to be different for everyone. There are going to be different staffing levels based on the phase-in of individuals to come into services. And though I didn't plan a whole lot of discussion on transportation today, the whole realm of how do we get people to and from the supports they need from us is a huge issue. We are not going to be able to transport people in vans the way we have in the past. We have to think about transportation in a whole new way. And then do you have all the resources to continue the protections for cleanliness and reducing the spread of the virus? Because the virus hasn't completely gone away. It's the coronavirus. It wasn't just the COVID-19 virus that we all have to be thinking about going forward. So social distancing, how much space you have in your buildings, and how you can accommodate people coming and going in those spaces, or will you create different kinds of spaces and retrofit the spaces you have for different things? So all of that is a balancing act that you need to really be thinking about now. And as we see from just this very beginning conversation with the state staff in Maryland, they are very interested in hearing your concerns, understanding them, and using the resources they have through the new relief bill to help shore you up through this transition of reopening. And all along, keeping in mind that we also are moving fast and furiously to the deadline of compliance with the home and community-based settings rule. Next slide. Some approaches of reopening. Certainly keep in mind realigning with whatever Maryland puts out as reopening guidelines. We have the CDC stuff, we have what your governor will put forward, and that will continue to change. It's definitely a phase-in approach, as I said. All states are thinking about this and talking with their providers about this. The assessment of risk has to happen at an individual and family and residential environments that people live in point of view. So it's both a self-assessment at the individual and it's an assessment of risk within the households that individuals live with and in who they'll be in contact with when they come into the community at large. And then certainly the individual's readiness, both in terms of all that we know about individuals' perceptions, what they know, what they understand about myths and reality, all those kinds of things come into play for individual transitions. And we also know, and which is very important as providers and support staff, we have all experienced trauma going through this pandemic. Some of us have felt greater trauma than others. Individuals with disabilities have felt those traumas. And every time throughout our lives we experience a new trauma, we have and we know from all the work that informed trauma practitioners have shared with us, new trauma builds on old trauma, and we have to be sensitive about that as we open up our programs. Individuals have felt trauma through this pandemic, and if they've had past traumas that have really influenced their behaviors, their responsiveness of stimuli in the environment at large, we need to think about how to support them as they work through that and re-enter into greater exposure that we're all hoping to have through the summer months. So next slide. Dignity of choice as people leave home. I'm going to let you reflect back on this slide as we finish this webinar today and you look at the slides. But we need to continually revise the person-centered plans that individuals have, and then how service plans will be authorized. I shared with you just a minute ago the importance of risk and mitigating risk. We have to collaborate in a way that we've never done before. We've always thought about the importance of collaboration and talking with case managers as providers and others, but I'm going to share with you the importance of collaborating amongst providers themselves. One of the lessons I learned when I shifted, closing buildings and shifting into the agency had made the choice that we were going to enhance our employment services and offer all of our services outside facilities. That's a personal provider organization decision. But one of the things that I learned during that is that as we decreased, there were still individuals we supported that didn't want to choose to go down the path we were as an organization. And out of respect for those individuals that were, and their families that were very dependent and happy with our organization, I had to assure that they were offered other options within our systems. And I had to have conversations with other providers that I trusted and I built relationships with to help those individuals move towards services to those other providers that offered different kind of services than I was and our board and our organization chose to offer. So I want to plant that seed for you. Start collaborating together and thinking about, because we already know we share staff. I don't know an organization that can say that all of their direct support staff only work for them. So think about that as you think about reopening and how much capacity you are going to be able to open up at one point of time. It's not just the experience I went through and shifting the model of service we delivered, but also how we phased in. Some of you are going to be able to phase in faster than others. Use each other through the collaboration in your local communities to help support all the individuals in our system. So I'm going to plant that seed. Next slide. So do you have a plan for reopening? Anyone out there have already started? I can't believe you haven't started thinking about that. But have you really put pen to paper and really thought about how you phase in? And think about in what environments are you going to open up services in? Remember, I said earlier on, as we have scanned across the country what families and individuals want, they want a hybrid type of service. They want us to be able, as a system and as providers, to help them make connections with other families on a more regular basis and help us create what I would call the backbone of the structures to make that happen. So do we help them have the email and phone numbers and introductions to other families and individuals that they might want to connect with to understand what options they have? So are we going to deliver services remotely? Or are we going to be able to purchase the technology, both as providers to manage for our staff and our systems of managing accounting on hourly units of services that link to billing with case notes? Are we going to be able in our reopening plans to use our facilities differently? Do we have all the cleanliness protocols put in place? All those kind of things. And I'm not, as I said, not even talking about the challenge of transportation. And how are we going to help individuals access community activities that the rest of us use in our daily life when we're not working? And how many of you as typical facility-based providers are going to be able to shore up hiring qualified employment specialists that can help people come back to the workforce? Because new jobs are going to open, no doubt about that. And individuals with disabilities, we want to assure in our systems have the opportunities and are front and center as consideration as workers for the new jobs that are opening up in the industries that we'll see happening probably by mid to late summer. So next slide. I'm guessing we don't have any questions, but Patricia, I should check in before we move on.
No, actually, most of the comments are specifically just statements and about how to use some of the rates for the DDA, but I'm responding to those probably in here. I think we have about 10 more minutes and you still have about 7 more slots to go. So, and I did wanted to share with you that some people really never did close. And some people did close, and some people went straight to virtual support. And so some people are just making that comment here. Well, we never closed. Good for you.
Yes, absolutely good for you. And I actually am not surprised that you're saying that or acknowledging that. Certainly that's been the case across the country. So kudos to you for managing to figure out how to stay open and viable through this past year. It's been a hard go, we know. So this is just a reflection of things that I've previously said, and really want to encourage all of you to communicate. We can't do enough of this kind of conversation together right now to think through together how we might move forward and really fully support people as we have in the past, but differently. Next slide. I'm going to jump over this. Let's move to the next slide. You have heard through the tone and the words I've said, how can we now open and reinvent our services? And I would put forward, we have a moment to seize. Next slide. A meaningful life is really a construct of having a purpose, a significance, and help individuals how to satisfy life. And that means not just going to a building like we did in high school or in grammar school to go to a class during the 5 days a week, but to really have a lot of variety in our daily lives. Most adults in our country between the ages of 16 and I would say 75 now support the economy, and we work for a living, and that should be no different in expectation for people with disabilities. That'll take all kinds of forms, and many of us don't work full time. When we are in a full economy and the general non-disabled workforce is working, about 30% of us don't do full-time work and do all kinds of other things during our life, daily life. And that should be no different for people with disabilities. So Maryland's an employment-first state. So front and center is thinking about employment. So next slide. Employment is a basic part of how we connect to all aspects of our life and how we build relationships and social networks. Our routines as working age adults in this country are often focused around our work life, whether we work full-time, part-time, or don't work at all. It's around the work life of the household we live in. So think about that as you're reopening and moving forward. And just one thing I would want to point out about what we know about employment services during the pandemic for people with intellectual and developmental disabilities. Those that had jobs in individual jobs in the community that fell under that category that we now are calling competitive integrated employment as defined in the Workforce Innovation and Opportunity Act, WIOA, sustained their jobs over any other kind of work support, be it facility-based, group-supported employment, or enclaves within industry. So moving forward, survival of who gets the best jobs and who makes the most out of the opportunities in employment, and who have said to us they want an integrated competitive job, it's those that we support in individual jobs. So think about that. Our work is not isolated from the rest of our lives. Rather, it's just a woven in part of our lives. And we should be thinking about that front and center as we reopen and support individuals, regardless of what kind of supports they need from us. We know at this point in time in our system of supports that we can support the most individuals that present the most complex challenges for us. And just because that's challenging for us to consider individuals that have major medical challenges that need ongoing support on an hourly basis, we have learned from them that they can do jobs in the competitive workforce. And it might be remote work. We have some data that's showing us that individuals with really complicated challenges are getting new jobs in the teleworking industry. So think about that. Next slide. So the other thing is about staffing, and I prepared a few slides for us to talk about, but I'm thinking, Patricia, we might want to move forward through these, but we need to talk about how do we reestablish our workforce.
Yeah, Lee, I thought they were really critical, and I know we only have like 7 more minutes, but I really wanted folks to see if they can join us for maybe a little 10 more minutes extra. While we may not be able to discuss and dialogue and hear your thoughts, I really wanted you to hear Ree's comments and thinking about what people are doing out there when it comes to staffing. So if you don't mind, we've had a consistent 283 people. They're very tuned. I got some raw positive feedback. So I think this is really good. And again, we don't have the answers for everything, but as I'm thinking, some of you have done phenomenal. I've seen all kinds of ways of how people are advertising for staff. I've seen different ways that people have the recruiting through their social media, through different things. So this is really important. And Rhea, I don't know if you had any job descriptions that we can share from NASDDDS to share with our team, and we can put them in our newsletter on our website. So if you guys wouldn't mind, Rhea has about another 5 more slots, 6 to go. And then we're going to just share some resources. We may just take a little over, but I thought it's important, maybe not to dialogue, but things to think about when it comes to staffing. So I'm going to turn it over back to you, Lee.
Okay. So I have shared some of this already. you really need to scan your workforce if you haven't already. Now is more than time to get ready to do that. Are your workers ready to come back, and what are their concerns? And are you prepared as employers to, if you have staff come back that challenge you about ADA accommodations and how you'll manage that when you need them on the front line, and how can you adapt with the new technology tools that are available to help them do their jobs. So you may have more remote direct support workers, believe it or not. As you've already indicated, several of you that have remained open are delivering remote services. And one of the kind of things that we've learned that's sort of a new best practice, or emerging practice, I should say, is, I don't know how to define it other than on-demand remote supports for individuals. There's some new technology out that individuals can wear on eyeglasses. It comes out of the blind and visual community, where individuals that are blind and have visual challenges can have on-demand support by individuals that sit in a center and monitor when individuals need their help at a very moment that they're dealing with seeing something on a screen they can't see and maneuver, walking down the sidewalk, getting lost and not knowing where to turn, or tripping over something, or in their home and they can't read directions on a recipe that they're trying to prepare for a meal. So this new technology allows for individuals to have on-demand support by an individual support staff. And so it almost is like a call center, but a real life person would step in and visually be able to see what you're seeing and help you figure out what's going on. And we have some providers across the country that are testing this technology beyond for people with visual and blind challenges, and using it for individuals with intellectual disabilities that are in living situations where they have alone time, or they live on their own, or want supports when they're out and about in the community, that they're going to the grocery store for the first time by themselves, and staff remotely monitoring them and have both audio and visual contact with the individuals without being present. And if a support staff could monitor 5 people at a time through that kind of support service, how wonderful would that be to help individuals expand their independence and learn how to be more independent without us being right there side by their side, but really being there side by their side. So some things to think about that in your recruiting of staff and use of technology and accommodations of staff that will have challenges in coming back to work. So next slide.
Someone in the audience said that this is called My Eyes.
Yes, there's a couple different, and we can put them in resources for you, and I'll make sure that Maryland staff have those. So support people who support people, that's our staff. We need to be flexible with our direct support workforce. Think about all those benefits that you offer and wellness programs, and giving staff time. And this is going to be a huge challenge for our system to do, because we've built units of service based on staff ratios and direct support billable time. But we need to learn as a system, and hopefully as we move through reopening, you will help the state system learn some of these challenges we have in expanding our funding methodologies to build in those well-being supports for our staff. Always set a North Star. We want a healthy, strong provider network, and that means having the strongest direct support workforce, where we actually have more people wanting these jobs and stay in these jobs longer than ever before going forward. And also can't remind us all enough to express kindness and patience as we deal with the traumas and challenges. I can tell you there are days that I'm at my wit's end at the end of the day because I've been on screen all day, that I just can't talk or think or do anything. That's a part of our new world of work. So let's be kind and patient with each other as we phase in our expectations to reopen all of our services. So next slide. I think we're down to the end. This is just a tool to use to help you reflect as your phase in. Many of you might have seen this kind of tool before. Start thinking through what would be your high demand services and the least demand staffing, because we don't have the direct support workforce we once had and will need going forward. So as you think about how you're going to phase in, think about using this kind of tool, that you really think of those high demand, low demand services, and it'll help you get to the capacity you want to, and hopefully will expand your services. One of the things that we continually expect to happen in our system is that we are going to close the gap to waiting for services and really support more individuals. It might be that as we move forward, individuals won't need what has been sort of typical, the expectation that if you get day in and employment supports from our state systems, you get about 30, 35 hours of support a week. Hopefully that will change, and some people will need more and some people will need less, but we won't build our systems based on that specific old model. So next slide. I think we're down to the end. Just a reminder, once again, we are coming in fast and furiously, even though we've had a year extension on compliance with the HCBS settings rule. This is our opportunity to really leapfrog forward with the intent of compliance. Next slide. I think I left this in. Remember that what we have been working on, because we have come fast and furious into the need to be in compliance with the settings rule, our first reaction is to do the basic minimum, get things set up, get us in basic compliance. But I want to just remind you all, as I said a minute ago, the intent of the settings rule was really about bringing us further forward into the civil rights of individuals with disabilities in this country, and really about meeting the accommodations they need to live everyday lives as if they didn't have a disability, as we had hoped to happen when the Americans with Disabilities Act was put into play. So I just encourage you to give a lot of thought to, as you think about your reopening, to always have in mind that brass ring goal of moving on to the extra mile, and really thinking about the ultimate goal is that we support individuals with challenging and intellectual and developmental disabilities in a way that they live an everyday community life. And if someone from the outside that didn't know our system would recognize that they were someone that was dependent on public supports. So next slide. So beyond COVID, rethink, reinvent, reopen, and always remember, change is not a criticism of the past. It's just a way to improve and move forward. I can't stress that enough. The system has been built on what we've asked you to do as providers. And now we're challenging and asking both ourselves and you guys to help us take it to the next level as we reopen service delivery. So there, we'll stop there.
Thank you, Ree. And I know that in the handout, there's some information that Kathleen put there for resources for providers. It's pretty self-explanatory. I want to be respectful every time. I really thank you all for staying an extra 6 minutes. I know reopening or reinventing or reframing your business model is not easy. I know that the regional directors and the deputies are meeting with all of you in small groups. We're here as a resource. If we don't know the answer, we'll go to national agencies like NASDDDS to try to bring them in to share what they know and what we know, and to provide you the guidance and support that you need. And Kathleen, who's helping me from the Eastern Shore, has been available and will continue to be available as we move forward. So I wish you the very best. We are here. Please feel free to chat, add questions in the chat box, send them to myself directly or Kathleen, and we'll be able to share them with NASDDDS. And please know that this is not the only time we'll have Ree. We'll continue to come and revisit as this is an ongoing effort and an ongoing challenge, not only in Maryland, but throughout the state. And I really want to commend some of the providers who I know Kim Kashidal and Kathy and Nick and I have shared the effort that you've done, the soft openings that you're doing, the creativity that you're doing, taking advantage of all the possibilities with grants and proposals and partnering up and doing the community of practice. So I really thank you. And Ree, if there's anything that they give me that I think we need additional support, I'll make sure I'll reach out to you. So thank you all. And I'm going to leave this open for a little while in case you want to chat or put a question in there that you think is critical that we want you to answer. I would thank you so very much, and you guys have a great day. Thank you.
And thank you all for letting me be here sharing this with you.
Fantastic. Thank you, Ree.